the number one thing that affects women from perimenopause to menopause and beyond and really limits their mobility in life is having back pain. An acute bout of back pain is no fun. It can really put you down. It can cause a lot of frustration because you can't be as active as you want to be. I know I have felt that before. But back pain in the menopausal stage is very common, and the information out there many times is telling you to do certain things to help it, but is it really going to speed up your recovery? Well, my name is Dr. Dawn Andalone. I'm a women's health physical therapist. I've helped thousands of women overcome back pain in a more holistic and natural way without medications and surgery. And today I want to talk you through the top 4 things I see women do wrong and what you can do to flip the switch and get your back feeling better faster and keep it from coming back. So why does your back pain actually get worse in this menopausal stage? Well, your hormones are shifting. It's creating some different stresses to your body, whether that's changes in your ligaments and your tendons, and also your muscle girth and your muscle tone tends to go down a little bit. So we need to work harder on some weightlifting exercises, adding in more protein. There's other things that you can do to combat the effects of this menopausal stage. Outside of that, your back is going to feel the stress and pressure upon it of things that you've done with the accumulation over the years. It's usually not one specific thing, like a car accident or like trauma to the area with a slip and fall. It's usually bad posture over time or repetitive injury or doing things that you don't realize over time has really accumulated a lot of stress on the discs in your back, the joints, and the muscles around it. So we need to work a little bit harder on the stability and strength around your midsection and help support your back in a better way. While women who are undergoing these changes and experiencing back pain, it may come on fairly suddenly, like you bend over to brush your teeth, or you go put your shoe on and all of a sudden you feel like your back is out and you need to be lying down doing nothing. I know I have been there before. It's not fun. So if you go to your doctor and your doctor usually is going to recommend take these painkillers or this muscle relaxer and just rest. Yes, for the first 12 to 24 hours, you do want to lay low, get the symptoms under control, but you want to start moving. And what type of movement? Well, just regular walking. Now, if the doctor says rest, that is the number one thing that can really hold you back from getting better. So initially, yes, but then after that, get up, get moving, get walking. I'm talking about walking on flat roads, flat terrain, and going for a 20 to 30 minute walk is going to provide a lot of benefit. You're going to get more blood flow and circulation to your muscles and your joints, and therefore your back is going to start feeling like it's getting some therapy, it's getting better. This also will make your muscles weaker if you're just resting and laying in the couch or laying in a bed for 7 days' time. Your back needs that movement. So that is the first thing. You're not just going to rest for 1 to 2 weeks. You're going to get up and start walking as soon as you're able to for some exercise. Now, number 2, you may feel like you are itching to move and itching to stretch. Maybe you think a yoga class is a good idea if your back is under a flare-up, but not so much. Overstretching can be a big common culprit to make your symptoms worse. And if you don't know the right types of stretches for your back and what to do initially when you're in this flare-up, you can make things worse. I see people try to stretch their hamstrings or bend over and put their leg up and try to do a lot more stretches. But if you have an injured area that's creating some stress on a disc in your back or ligaments or muscles, this can actually flare up your symptoms and make it worse because you're overstraining the area that's injured. So going back to just some gentle core movements and some breathing, I have another video about diaphragmatic breathing and also about sleeping postures and the best ways to sleep if you are having back pain. So you can go back and watch those after you watch this video. But those can be very helpful to find positions of comfort, but also start integrating some deep belly breathing, some core breathing, and activating those deeper muscles through your abdominals and your pelvic floor to help bring more blood flow and circulation to the area and help your back heal. So that is the second thing, is to not overstretch. Now, the third thing, and there are ladies who are very into wearing high heel shoes. Luckily, a lot of us work from home, or we don't have to dress up and go to an office or dress up for events all the time. But if you are in a situation where your back is hurting or just a little bit, don't put on high heels. This is going to throw off your alignment and your posture and put you in a position where your back is going to have more strain on it that it's not used to. And therefore, your glute muscles and your muscles through your hips and your pelvis can't work the same way to support your spine as they were doing before. So instead of high heels, wear platform shoes or something with a flat, something that is not going to throw off your pelvic position to create more strain on your back. Now, the fourth thing that I notice as well is women tend to carry heavy bags or purses. And if you're going for a walk or you're going to the store, your back is starting to bother you a little bit. Even if it's a small amount, this can throw off your symptoms too. A heavy bag is going to pull your spine to one side. It's going to put more pressure on that area that's bothering you and therefore create those muscle imbalances again. So instead, it's best to wear one of those little belt bags, something with just your wallet or your phone and your keys in there, something small that can keep you hands-free and keep you walking without having to bend from one side to the other. Even a small backpack can be more beneficial than wearing a purse on one side or the other. Now, I have some other helpful videos, like if you're going traveling and you're having some back pain, what things to avoid, or even if you're driving a lot and sitting in the car, and how to think about your posture and therefore putting less stress on your spine. So those would be other videos to go and watch if you're having a bout of back pain. I know it's so common and it can be very frustrating when you're having back pain, but if you're a woman in this perimenopause to menopausal stage and you are experiencing back pain, taking up exercise like therapeutic Pilates or something that's going to affect that your muscles around your midsection and around your core can be very beneficial to the long term so your back pain doesn't come back. Because most likely, if you have a bout of back pain, it can flare up again within 5 to 10 years again, and sometimes come back even worse than what you had it the first time. So just take note of that. You want to do an exercise program of something that's going to keep your back healthy over time. We say it's like a car, it needs maintenance. And therefore, if you're not treating your body like that and giving it maintenance and giving it what it needs, even when it feels good, it's not going to break down like someone else that did not give it maintenance. So I hope you found this video helpful. Once again, those 4 things not to do if you're having an acute bout of back pain. Go back and watch it again. Thank you so much for listening, and hit subscribe if you're not already a subscriber of this channel. I put out a lot of videos about back pain, Pilates, other ways to help you feel the best in a more holistic way. So thanks for watching and have a great day.